turning to our health lead now. It is called How the Pandemic Defeated America, and it's an in-depth new report in The Atlantic. More than 100 experts were interviewed to find out why this coronavirus is hitting America so much harder than most other countries. So the article lays out how nearly everything that could have gone wrong did. Hospitals were underprepared, public health teams were underfunded, and systemic racism left people of color more vulnerable to the virus. But it also points to one other glaring issue: inaction by President Trump and the federal government, especially in those early days, noting, quote, "America first was America oblivious." Joining me now is Ed Yong, a staff writer at The Atlantic and the author of this piece. And I read every page of your article, and it is so insightful, Ed, on so many different levels, just really peeling back the layers of how we got to this point 6 months into this pandemic and having one of the worst outbreaks out of the 50 most populous countries in the world. And an epidemiologist at Harvard Medical School told you this, quote, "The U.S. fundamentally failed in ways that were worse than I could have ever imagined." How did one of the wealthiest countries in the world get here, Ed?
It's a good question. It's one I've been trying to answer for months now. I think so many vulnerabilities contributed to America's poor performance here. Obviously, a poor federal response was part of that. Trump and his administration have ignored and dismissed experts for the entirety of their time in power. They have not listened to sound advice. They have promoted misinformation. And it should be no surprise then they failed to take account of any of the warnings that were given early on during this pandemic, allowing the virus to spread through the country. But that virus then found prisons that were overstuffed with people, nursing homes that were understaffed and underfunded, public health departments that had been underfunded for decades, hospitals that were stretched thin, and that where exorbitant amounts of money were spent but for very little reward. And it found all the inequalities you spoke of, the legacy of America's racism and colonialism that left people from indigenous and black and brown communities disproportionately affected by this virus. There are so many historical sins that have come to roost right now.
Absolutely. And like you said, this pandemic has been both tragedy and teacher. And I think it's causing a lot of us to step back and say, okay, what is it about our history that we need to do a better job on moving forward? What can we learn from this? And one of the glaring issues you laid out in your piece was looking at the hospitals. And one doctor told you that hospitals are prepared for trauma like mass shootings or hurricanes, but not a pandemic. Why is that?
So they are prepared for short-term disasters, not long-term, recurring, rolling ones, especially not ones that affect all 50 states at once, and thus producing a huge amount of pressure on the system and on the supply chains that provide equipment and drugs on which the hospitals depend. There's also the fact that America has this weird and unique system of health insurance that ties healthcare to employment. And so in a situation like this, when millions of people have lost their jobs, millions of people also have lost access to healthcare at a time when they need it the most. And finally, this country specifically has this attitude to healthcare where it focuses on treating people who are sick at exorbitant cost rather than preventing that sickness in the first place. So that is the job of public health, the job of vaccination, sanitation services, and that has been chronically underfunded and undervalued for a long time, which means that people in this pandemic got sick. And then they flooded hospitals, which struggled to cope with them. Now, if we can change that attitude, if we can focus on systems that will stop people from getting sick in the first place, if we can value that like we value hospital-based healthcare, we will be in a lot better situation, not just in this pandemic, but in future
Right,
ones.
those mitigation steps that public health experts keep saying you should do. And when you talk to the president, when you bring up missteps from the government early on, one thing that he continually points to is the China travel ban, as pointing out, hey, look what I did. I went against some of my advisors and put a ban on China and travel. But you lay out why that wasn't a panacea. writing, quote, "In practice, travel bans are woefully inefficient at restricting either travel or viruses." Can you expand on that?
Yeah, I grant that travel bans seem like a very intuitive measure. Obviously, people who are traveling around the world carry and spread the virus. The problem is that travel bans are actually a really bad way of restricting either viruses or indeed travel, because people find ways of circumventing them. If you block one country, people will go via an intermediate. If you launch a travel ban, as Trump did against Europe, a lot of people will flood to your country in anticipation in order to avoid that ban. And besides, Trump's travel ban against China in the initial days was incredibly porous and let tens of thousands of people in. So it seems like a good idea, but in practice it just doesn't work, and it leads to a false sense of security, where someone like Trump can think, I've solved the problem, I've put a travel ban in, without doing any of the things that they actually need to do, like instill testing, like getting hospitals ready.
Now, really quick, before I let you go, obviously this is a very critical look, but what have been the bright spots in your view? You know, the administration talks about, look, we have all the ventilators we need. We have seen Americans coming together in many ways. What to you are some of those bright spots?
I think one of the bright spots is that despite America's stereotypical hewing to individualism, this rugged individualism, so many Americans did take collective action for each other's good. They stayed at home. They're wearing masks, a lot of them. And I think that it shows that the American public have been willing to take the actions necessary to save themselves and each other. And that is what we need. Now, if only they could do that with the support of the federal government, not in opposition to it.
All right, Ed Young, thank you so much for coming on.
Thank you for having me.
And up next, they said they treated